Hey, this is Justin from CFAS. I'm going to do a quick how-to on how to check a jump bag. Open up the main compartment. You knock out the scope and the rubber gloves. Get those out of the way. Jump to our oxygen tank. Lefty-loosey, righty-tighty. Make sure it's above 500. This one's at 1,000, so we're good. So I tighten back up the regulator, and I bleed the regulator out. It's empty. Close it back up to 0. Record that number on your rig sheet. Next, make sure I have 2 adult NRBs, 2 adult nasals, and 2 pediatric NRBs. These we use for trach patients. Again, this is a primary jump bag, not a pediatric bag. Move on to our blood pressure cuffs. Make sure you have a regular blood pressure cuff, a long, and then a child. There's 4 sizes. This is the next size smaller than your regular. It's used for a smaller patient in the purpose of this bag. So we open up our cuff, roll it out. We want to make sure our bulb and our dial are in good condition. The bulb opens and closes, and the dial isn't cracked. So we get them, put them towards the center. Any extra cord, roll it back in, and we roll the entire thing up like a burrito. The purpose of this is to keep the blood pressure cuff in the same condition every time you grab it when you need it on scene. You don't have things loose, it's the exact same way. And also, it fits in the bag nicer, prevents it from getting hung up or caught on the zipper and damaged in any way. Do that for all 3. Convenience bag is tucked in between in this bag. Next, we have our OPAs and our NPAs. OPAs, you want to make sure they're all here, the colors are here, and they're listed here on the box as well. There's a spare oxygen key. Our NPAs, obviously you have your lube. Make sure you have a good assortment of sizes. I like to keep a 28 or the next closest size in the front because it's the most common size, and you can adjust the size accordingly if the 28 doesn't fit. Next is our pen light. Make sure it works. Next is glucose. Record the date on your rig check sheet and make sure there are no cracks in the nozzles or it's leaking in any way. Shears. Next is our N95 masks. Make sure you have some in there. Close these back up. We move on to the outside compartments of the bag. Here we have some trauma supplies, so you have combine pads, occlusive pads, and your 2x2s and 4x4s. We also have some ice packs and heat packs. Next is our BVM. You want to make sure all the pieces of BVM are in here, and most importantly, make sure the mask can still hold a good seal against the patient's face, so make sure this isn't deflated. Tuck this in nicely. Make sure it's secured. Here we have our sterile water, a SAM splint, and large trauma dressings. And to finish up our trauma, we have some clings and cravats and tape. This is not a trauma bag, but this should get you by the first 10 minutes on scene. You can always go back and get more resources. This is a jack-of-all-trades kind of bag, so it's not really a specialty bag. And lastly, to finish up, you want to make sure your zippers are facing the accessible side of the bag, so they're not tucked in between pouches of the bag. They're accessible, so when you grab it, you can find the zipper easily. So as you can see, all the zippers to the pouches are accessible. And that's it. That's how you check a jump bag.